In any world that is teeming with life, hidden dangers will always remain lurking in unexpected places. And that is why today I'm going to talk about an assassin. This silent assassin has craved countless lives, leaving devastation at its wake. This silent assassin has instilled fear in the hearts of thousands and millions of people worldwide. In the year 2020, for example, more than 600,000 lives were lost and 240 million people worldwide were affected by malaria. No matter how fervently the government and the dedicated organizations have tried to fight against this disease, malaria still persists, its impact reverberating across nations. And that is why today we are here to dive deep into the depths of this global crisis, that we can discuss and create awareness and come up with concrete solutions against this malaria. This is Dr. Evans and welcome. So what is malaria? That's the basics. We have to start with the basics. What is malaria? Malaria. Malaria is basically caused by a parasite called Plasmodium. We have many species of Plasmodium, like the Plasmodium falciparum, vivax, ovale, Malariae. But the most virulent or the most dominant is the Plasmodium falciparum. This Plasmodium is normally transmitted by a female Anopheles mosquito. And so let me take you back to the life cycle of Plasmodium. Once the mosquito reaches your skin, like ikikuuma, it releases more than 100 sporozoites into your bloodstream. These sporozoites will then be taken to the liver. In the liver, they enter the liver cells, which are the hepatocytes. At the hepatocytes, they multiply to form schizones. So when they form schizones, these schizones will contain merozoites that will be released to the bloodstream. In the bloodstream, they will enter the red blood cells. So here in the red blood cells, we have two routes. The first route is that these merozoites will mature to form trophozoites, which will continue multiplying to form schizones that contain other merozoites. And these merozoites, when they're released, they are responsible for the fever that one experiences when they have malaria. The other route that the merozoites will take when they enter the red blood cells is that they'll differentiate into the male and female gametocytes. On the second time, when this mosquito comes back to bite again, it will ingest, itachukua the male and the female gametocyte back to its system. So these male and female gametocytes will go to the gut, itaenda kwa matumbo yake. When they enter the gut system, the male and the female gametocyte, they will sexually reproduce to form oocyte, and this oocyte will then form the sporozoites. And you know the sporozoites will then be taken to the salivary glands, so that ikikuuma tena, it will release those sporozoites back to your system. So clinical features of malaria, or the clinical presentation of malaria. So normally the incubation period for malaria is between 7 and 30 days. And if fever occurs before the 7th day after a person has traveled to an endemic region, then most probably that fever is not caused by malaria. So patients with malaria normally present with flu-like symptoms such as fever. This is raised body temperatures. They can also have chills. This is whereby there is rapid relaxation and contraction of the muscles. The person will be shaking. Then we have increased sweating, or rather we call it diaphoresis. The patient can also have headache, joint pains, abdominal pains, nausea and vomiting, irritability, and sometimes for children they will refuse to feed. Those are for uncomplicated malaria. So when it comes to complicated malaria, or rather severe malaria, this patient can present with prostration, whereby the patient is unable to sit upright, stand or walk. This patient can also present with altered level of consciousness or drowsiness. We also have cerebral malaria, which is an arousable coma that is not attributed to any other cause with patients who have falciparum. This patient can also have respiratory distress, hypoglycemia, whereby the sugar levels are less than 2.2, jaundice. They can also present with shock. So it's very important as a doctor to be on alert of these symptoms. So how do you diagnose malaria? We start with the basics. History. Take thorough history. Check if the patient had traveled to an endemic region recently. So make sure as you take your history to rule out any symptoms of severe malaria. Then you do the normal test, the routine test, the complete blood count, the sugar level, the coagulation profile, and also the liver function test. When it comes to parasitology, we can start with the rapid diagnostic test, which tests for specific antigens for malaria. This test is not a confirmatory test, therefore you have to do a confirmation test later on. The other test you can do is blood smear. We have thick blood smear and thin blood smear. Thin blood smear is the best for confirmation of malaria. The treatment of malaria, you've done your test, we confirm ujama akona malaria. What do? The first time medication for malaria is AL. We call it AL, artemether lumefantrine. It is one tablet which contains 20 milligrams of artemether and 120 milligrams of lumefantrine. This drug is normally given in 6 doses for 3 days. On day 1, you give the first tablet, then you give the second dose 8 hours after the first dose. The third dose is given at 24 hours. The fourth one is given at 36 hours. The fifth one is given at 48 hours. Then the sixth one is given at 60, the 60th hour. Remember, the dosage is the same regardless of if you are immunocompromised, such as patients with HIV. The children are normally given half the dosage. And remember, kumbuka, hii dawa unaimeza hadi mwisho. Make sure you take all the doses even if you're feeling better. Now, that is for the malaria part. For the fever, you can give the paracetamol. Also, you can do sponges, like a sponge kiasi, so that it can reduce the temperatures. And also, it's good to take fluids and good nutrition. Tutakule na tulie. Now, sometimes we can have treatment failures. Maybe for some reason on the third day, there is no improvement. What do? You repeat the test. Take another microscopy test and give the second line of medication, dihydroartemisinin piperaquine. It's just given once daily for 3 days. So what about for severe malaria? Here we give parenteral medication, that is parenteral quinine or artemisinin. Quinine, let's start with the quinine. How do you administer quinine? Doctors, quinine normally is not given as a bolus, it's given as an IV infusion. So we have the loading dose and the maintenance dose. The loading dose for quinine is 20 milligrams per kg in 15 milligrams per kg or 5% dextrose, which is given as infusion in 4 hours. Then 8 hours later, you can give 10 milligrams per kg of quinine in dextrose. This dosage is maintained 8 hourly. Every 8 hours, you administer 10 milligrams per kg of quinine until the patient is able to take oral medication. This point now you administer the artemether-lumefantrine AL, complete dose for AL. So for artesunate, normally comes as a powder, which you combine it with sodium bicarbonate and then you mix it with 5 ml or 5% dextrose. So for the start dose, you give 2.4 milligrams per kg, slow IV infusion. And then after that, 12 hours later, you give another second dose of 1.2 milligrams per kg of the artesunate. Then the third dose, you give it at 24 hours. After that, you give once daily until the patient is able to take oral medication, after which you give them AL, complete dose again. Remember, this artesunate can also be given as an IM, that is intramuscular injection, similar dose. As we know, severe malaria will normally present with other issues. Then, for example, if it's hypoglycemic, you manage the hypoglycemia. If they are in shock, you manage it. If they have pulmonary edema, you give them oxygen, you make sure you prop up the bed. For the fluid imbalance, make sure you correct the fluid volume. The patient can also present with anemia. Therefore, you transfuse. Remember that this disease is one of the highest causes of morbidity and mortality in children, especially those less than 5 years. So make sure they sleep under mosquito nets, they wear protective clothing, and also spread awareness. Ambiana kabisa. People need to take care of this disease because it's proven to be one of the biggest threats to mankind. Also remember that when you're traveling to an endemic area, you take prophylaxis. So for example, you can take chloroquine. For pregnant women, you can undergo intermittent prevention treatment for malaria in pregnancy, IPTP, and these will prevent any complication that might arise. They are normally given 3 tablets that contain sulfadoxine and pyrimethamine. Thank you. This is Dr. Evans, and it was nice having you. See you in the next one.